Hey, what's up, everyone? It's Dr. Glenn Vo, and I am super excited to have Chief Marketing Officer of AcceptCare. Oliver Gels. Oliver, what's up, man? How's it going?
I'm doing well. I'm channeling my flannel here at the Dental Festival.
And
Thanks for having me.
I want to let everyone know today is actually Flannel Day at the Dental Festival. We're in the AcceptCare Lounge. So yes, it is nice flannel, but he does wear other things as well. So I just want to let you guys know about that. But I wanted to talk about AcceptCare. Obviously, I let everyone know I've been just kind of behind here working with the team here about AcceptCare. I'm really excited about what have to offer in. What is AcceptCare and what was the motivation about it? And then also, how's that going to help dental practices?
I mean, the funny thing is we've gotten a lot of questions about it. Obviously, we've had this lounge. It's intended to be a pre-launch, so pretty new news. A lot of people came up thinking that it was just another financing tool, another financing product. And although there will be financing in the product, it is not just a financing tool. It's really intended to be a revenue engine. It's all about jumping and boosting case acceptance by solving a lot of the issues that are out there in terms of making treatment affordable.
Well, let's just address like the big elephant in the room, right? The financing companies, right? Because here's the thing, guys, this. Every conference you're at, maybe every other Facebook Live done any of these Facebook groups, every other podcast, there's some new financing company, right? We don't even have to mention them. We already know who they are, right? And it's like, hey, we have the solution, because the big problem is for case acceptance, it's how's the patient going to pay, right? Well, this is different. And I want to know why it's different. Can you explain to them why it's different? Because again, let's talk about the traditional financing company. Like, hey, you are qualified for this, and this is what you get.
Exactly.
But AcceptCare, they do something a little bit different. I think it's really more patient friendly. So discuss about the traditional way and the AcceptCare way.
Well, before designing a solution, you always want to really diagnose the problem. And I think what we're all in this industry for is to increase access to patient care. And unfortunately, the bare fact is that there's still millions of Americans that either forego dental treatment that they need or only elect for partial treatment, all because there's an affordability gap. And, there have been lots of financing solutions out there for now decades that have been trying to solve it, but have, in truth, only solved for a very small portion of the gap. And the reason why is because all of the currently marketed solutions, albeit good, is the fact that all of these solutions are built for or by or around a lender. Yeah. And so naturally, everything about that product is oriented around what a lender's needs are, what their preferences are, what their requirements are. And so what you get solutions that have high rejection rates or predatory high interest rates, things that are not patient friendly. And so naturally, that's going to have a huge bite and a huge impact on case acceptance and people's ability to accept treatment. And, then secondarily, when that's not there, a lot of practices are starting to try to do their own financing in-house. And it's not intended to cover everything. Obviously, doctors don't want to take on too much risk or too much burden of collecting all that revenue. And so, they're generally shorter plans that have naturally, because they're shorter, they have higher monthly. So they don't really fit for higher end, higher ticket, dental procedures that a lot of patients need. And so where does that leave us? That leaves us with 34% of, treatment that is recommended is what's taken, and the rest is not accepted. So we're still leaving about 2/3 of recommended diagnosed treatment on the table.
And, so you hit on something that I think is really eye-opening and really what distinguishes what AcceptCare does from the traditional financing company. AcceptCare is not a financing company in a traditional sense. It's actually a tool, it's actually a platform to help practice owners get case acceptance, right? So again, let's walk through that process, right? Because right now, the traditional process is, okay, I have these 3 lending companies, I have, my own in-house financing company, and I'm basically going down the list and, okay, let's apply for this, reject, let's apply for this, reject, let's finally get to this. Oh, okay, let's settle for this. And, a lot of times, I don't know about you, but if I go through a process and I'm constantly getting rejected, I kind of lose my motivation to want to do something. But what's so unique about AcceptCare is that you guys kind of put the power back into the patient's hands. So let's walk through that. So that's the traditional way, right? Hey, I got these things. Let's keep on applying for all these things, and you keep on getting rejected. But AcceptCare has a very easy way, just one application, and then you kind of go. So let's go through that workflow really quick.
Yeah, so what's beautiful is we wanted to start a little sooner. So the typical, financing tool, you're getting to it after you've tried to, you've shown the patient the fee, you've tried to get them to pay in full, they clearly are not able to, they need more affordability, and then you take that moment of awkwardness to then have them fill out an application, which then is likely to be rejected, and to your point, a cascade of applications and possible rejections, which most of the time doesn't happen because after the first rejection, the patient will simply say, I need to go home and think about it, which is really code for, I'm not going to do this.
Yeah.
And so what we want to do is start earlier, right, in the workflow. And that is as soon as the additional incremental elective treatment is recommended or diagnosed, we wanted to start really there. And so this is a case presentation tool as much as it is anything else. And so through our workflow, the treatment coordinator or the doctor who's ever presenting treatment is going to be able to itemize and show the fee, what's involved, and then the patient is going to have an option in that workflow to pay in full. So we don't want to walk away from pay in full. We want practices to get pay in full. That's your preferred way of getting paid.
That's how I want to get paid. Yeah,
exactly. So unlike another one of these third-party financing companies that they don't want you to get paid in full. They want to get the loan themselves. We actually want to work it around what you need. And so, we offer that. And then if the patient does need financing, they're going to do one application in one workflow that's going to then send applications to a platform, a network of lenders who are going to compete for the right to have that patient choose them. And so that puts the power in the patient's hands. And so the terms are going to be, by definition, more appealing, more attractive because they have to compete to get these loans. And our goal is to try to get not only 100% approval rate, or as close to it as possible, but our other goal is to get complete care approval. That's the thing that people don't talk about.
Let's talk about that. Let's talk about that because I think that's really important. I'm not going to mention any company names, right? And they've been mentioned in this group a lot, right? So there's certain financing companies that say, hey, we get X percent. Normally it's a really high percent, 85%, maybe 95%. We get X percent financing for the patients. But there's something very misleading there. And I want you to talk about that.
Yeah, so it's clever. It's clever marketing. I'm a marketer myself.
Technically it is true, but
yes.
It's not. It's kind of like it doesn't tell the whole picture.
Exactly.
So let's hear the whole picture.
Exactly. And so they've set the conversation around this approval rate, and makes sense. What isn't discussed, though, is what percentage of the actual diagnosed treatment is approved, because there very well may be a case that we've seen and documented where there's $10,000 worth of dental care that's diagnosed and presented, and the patient will get approved for $500, which really doesn't go anywhere close to helping them to afford the treatment. And so that ends up being not accepted by the patient. So neither the patient nor the doctor get what they want, but the company is able to market that they included that as an approval. And so we want to break out of that mold. And so we're not just trying to get a high approval rate as close to 100 as possible, but we're trying to approve full, complete care.
And that's what it's all about, right?
That's what it's all about.
It's all about taking care of the patient and taking care of everything that's on the treatment plan, not just paying enough for the next appointment, right? Just to book that appointment there. So let me ask you this, Oliver. So again, right now with AcceptCare, the release date, you guys I've already saw the platform just to let you guys know. It looks amazing, but it's not fully released yet. And right now we have beta testers that are coming on, and I'm gonna let everyone know right now, first of all, you want to be a beta tester, but there's only so much room to be on the list there. But what's the best way for them to get on the beta testing group? What's the best way?
We've currently got a pre-launch landing page. I think you'll be able to see the link sometime during this segment. And so if you're interested, just click. What we're looking for is not only practices that do a fair amount of elective, higher ticket elective dental care volume, but also ones that are willing to and able to share some of their benchmark data in terms of their case acceptance, in terms of their metrics around how much they're currently paying for discount rates and their loan volumes and things, so that we can benchmark and make sure that we are really driving and delivering the benefits that this is promising.
Well, and I'm going to let you guys know this as well, is that kind of like the benefit of being a beta users. Number one, you get on the platform before everyone else. You can actually help get patients the care they need. Another thing too is like there's an implementation process as well, and you're just going to skip past all that and get that going right away. So again, this is really exciting stuff. We have the link for you to go to that landing page. Hey, a lot of people have already signing up, but you're going to learn more about it, and hopefully you can get into that beta group. So Oliver, thank you so much for jumping on, and we're going to definitely have him back more as this progresses, but really exciting stuff. So thank you so much.
Thanks for having me.
Guys, we'll see you guys next time.